Hey, it's Scott. And in this week's Give Me Five on the Go, I wanted to go ahead and touch on some unique ways to go ahead and use ketamine in kids. And how that comes into play is this afternoon, Nina and I are out west, specifically in Salt Lake City at the Great Salt Lake. And as I looked around, I saw not only the beautiful lake, but actually I saw all of these rocks behind me. And when that came into my mind, I remembered a talk from years ago, which is really kind of fun in medicine because there's always somebody who knows a whole lot more than you do. And there's always a whole lot of people who have different specialties than you do. And this is kind of neat, whereas a wilderness medicine doc was talking about alternative uses of ketamine. And when I saw these rocks, this was essentially his story. They're like they had a teenage kid who was hiking somewhere, fell off of a cliff onto a whole lot of rocks. And as the doc, along with the other medics, they had to immobilize, take care of, and transport this person, meaning carry them out of the canyon before they could actually make it to the ambulance and eventually the helicopter. And from what I understand, this girl who fell off the cliff had a bunk on her head. She was acting goofy, had a couple of fractures in her lower extremities, which of course were not pleasant. So he's like, option number one, he said, yeah, we could go ahead and put her down and intubate her. He said the problem is, if you do that and your protocol says do it, absolutely do it. He said the problem is, think about it. He said now I have to have all the people carry her on a spine board through the canyon while someone is trying to hold on to her endotracheal tube and go ahead and bag at the same time. He's like, nothing good is going to come of this. So he said, could you do it? Sure. He said, but what they wanted doing was really kind of neat. He said, we just gave her whiffs of ketamine because it was just enough to chill her out. It was just enough to go ahead and help with her pain, but she happily continued to breathe on her own. And he's like, in our monitor, we had a pulse ox and we had nasal cannula CO2. So we had a good idea as to air going in and out and blood happily going round and round. But he's like, we just went ahead and just pushed every once in a while little whiffs of ketamine so that way we could focus on getting her out of the canyon. And then when they were in the ambulance, they could do what they needed to do. So if you're in an ER, ambulance, helicopter, you got lots of bells, whistles, toys, and help. Fabulous. Absolutely do what you need to do. However, if you happen to be surrounded by rocks and you're not in the ideal environment, remember that ketamine, as long as you push it slowly, because it's kind of like fentanyl, right? Because remember, if you push fentanyl really fast, bad stuff happens. And interestingly, when it comes to ketamine, they've actually recently shown two things. Number one is if you push ketamine quickly, that is actually where you can get a risk of respiratory depression. Versus if you push it nice and slow, it's incredibly rare. And remember, the slower you push it, the less nutty they become. So if you're in a less than ideal situation and you just want to slowly give them little whiffs of ketamine, because remember the dose ranges anywhere from 0.2 per kilo all the way up to 2 per kilo, meaning literally 10 times difference in the dose to go from mellow to general anesthesia. So with that, if you just want to make somebody mellow and you're in less than ideal situation, little whiffs of ketamine, if they're able to maintain, is a really slick trick.